And thank you for being here and responding, for your testimony and for your willingness to respond to our questions. And in particular, I want to thank you, Ms. Joshua, for sharing your knowledge and your personal experience with all of us today. Since the Supreme Court's, I believe, the extreme decision overturning Roe versus Wade, 22 states, I'm told, some 22 states have enacted total abortion bans or severely restricted access to abortion. In fact, today I'm told that 44% of women of reproductive age do not have access to abortion care within their home states. As today's hearing and as Ms. Joshua's testimony demonstrates, we are seeing the consequences of these abortion bans across our country. They are dangerous in many cases to women's health and in some cases actually deadly. Mr. Chairman and colleagues, I support, and I think a majority of Americans do as well, continue to support women's rights to make their own health care decisions. And at a time when these most personal decisions and access to reproductive health care are under attack across our nation, we must work together to protect the fundamental right to access reproductive health care. Ms. Joshua, question I have for you. In your testimony, you talked about the impact on your own health care because of state restrictions on abortions. What would you want members of our committee to know about the dangers of extreme laws that would override the choices made by women and their doctors?
Yeah, thank you for that question. Senator, first I would want the members of the committee to understand that basic maternal health care is being directly impacted as a result of these egregious laws. I understand that others are insinuating that these laws are easy to interpret. Physicians have the discretion and expertise and training to be able to make the decisions, but we don't, right? They don't. And essentially my story, what I think it speaks to is this overarching issue where we're still kind of arguing, is abortion care health care? Is a miscarriage deemed necessary to be able to provide abortion care? Other definitions have kind of been thrown out here and there through the course of this, the messaging that we've heard this morning, and I think those are dangerous statements, and the very reason why places like where I live in Louisiana, we're seeing direct impacts, especially to women of color, in particular Black and Indigenous women are feeling the brunt of these egregious laws, and this will continue until we clear up and clean up the language and provide for abortion care in all 50 states, not just some. And so I hope my story speaks to all those points and also adds a layer around Black maternal health care, which is already really alarming and starking in terms of statistics around maternal morbidity rates, fetal morbidity rates. It's very alarming, especially in the Deep South. And when you add this other component of an abortion ban, it does not seek to address the issue, but instead exacerbate it.
All right, thank you for that. Physicians are increasingly leaving states with restrictive abortion laws, effectively reshaping the national healthcare workforce and exacerbating existing provider shortages. In states with restrictive abortion laws, physicians are caught in, I would describe as a bind. On the one hand, they face potential legal prosecution for providing abortion care under restrictive state laws, while on the other hand, they may face legal action for malpractice if they deny necessary care. As a result, hospitals are seeing providers leave their states to avoid legal risk, further straining healthcare systems and reducing access to care. Make no mistake, in addition to putting women's lives in danger, these extreme and restrictive abortion laws are oftentimes putting doctors in what I would describe as impossible positions, legally and ethically too. Dr. Huntsberger, what should Congress, and in particular members of this committee on which we serve, what should we understand about the challenges facing physicians to care for patients, and the same physicians facing potential prosecution for providing reproductive care, often life-saving care to their patient? Please, Dr. Huntsberger.
It is extremely difficult to legislate pregnancy and prenatal care, which is very complex and nuanced. Given the challenge of legislating medical care, because it can be so complicated, we shouldn't. these are the real impacts of government interference in healthcare, and it's a big problem, and it's affecting women across the country. Thanks for your question.
Yeah, a question for the record, if I could. Dr. Huntsberger, would you provide for us, for the record, some examples of how these extreme abortion bans are hindering the training of the next generation of healthcare providers? Thank you for the record.
Thank
Thank you all.
Thank you,
Thanks,
Senator
Mr. Chairman.
Carper.